everyone. Today I will be talking to you about what is AMH and what is its significance. AMH is a hormone that is secreted by the cells that surround the egg when they are at their resting phase. So, you will find that when you visit your physician for an initial consultation, one of the tests that he will first write for you is the AMH test. This AMH reflects the ovarian reserve, since it is that hormone that is secreted by the cells that are in the resting phase in your ovary. AMH remains constant and does not show variation either within the cycle or between the cycles, and thus it is a much more reliable marker of your ovarian reserve or the capacity of your ovaries to form eggs. The test is also recommended by the physician for he or she to understand how much time do we have left for your fertility. Typically, the levels that are anything above 2 nanograms per ml is considered absolutely normal. Levels that are below 1 are considered to be low and may require a warranty treatment immediately. Levels between 1 and 2 are considered as borderline, and such patients often do conceive even at home. Levels that are above 5 or 6 nanograms per ml may indicate that the patient is having polycystic ovaries. The AMH test is very important, especially for women who are marrying at the elderly age group. These are the patients that have low AMH. These are the patients who have reducing fertility, and thus these patients require counseling to try and get pregnant as soon as possible. Also, with the increasing number of cases of social egg freezing, wherein a lady decides to freeze her eggs just so as to delay motherhood, such patients are often recommended the AMH test so that the physician gets an idea about the capacity of her ovaries to form eggs and then counsel her accordingly. Patients with low AMH may require 1 to 2 attempts to collect at least an adequate number of eggs. Likewise, women who are belonging to the elderly age group and trying for a baby may also require multiple attempts because of the low AMH values. What we also see is that AMH gets affected just by vitamin D levels as well as oral contraceptive pills. So women who have been on oral contraceptive pills for a long time or currently taking oral contraceptive pills may have reduced values of AMH. Smoking also affects the AMH values, and history of smoking in women for long periods of time reflects in their AMH as low levels of AMH. Such women do need counseling and informed that they need to reduce and stop smoking. What we find is this AMH, since it does not vary from cycle to cycle, your physician is able to predict your fertility. So, patients who have good AMH, even in spite of being at the age of 39-40, tells your physician that she is likely to make a good number of eggs. However, at that particular age, what becomes very important is what is the quality of the eggs. If, however, your physician does get good quality eggs, then this indicates that yes, she is likely to get a pregnancy. Also, what is known is that as the female's age advances, the quality as well as the number both reduce. Your physician in such scenarios may require higher doses of gonadotropin injections to get the adequate number of eggs to help you get pregnant in an IVF cycle. In my later presentations, I will talk to you individually about the AMH significance and what women at 40 need to do, as well as does AMH really affect the chances of the pregnancy, and what should a woman be doing if the AMH is low. Thank you. The topic for the next presentation is, do all patients with low AMH require IVF?